We've seen so many changes in technology in the last 10 years that I was curious, what do you see as the changes in LASIK in the last 10 years?
LASIK has come such a long ways, which has contributed so much to the safety of the procedure. We now have trackers that track the eye more than 1,000 times a second, and laser spots that are less than 125 parts of an inch. That makes the predictability of the procedure so much better. 99% of my patients will see 20/20 with both eyes open with the first surgery. So the predictability has become better. The quality of vision has become better. Recently there was a study by the FDA, sponsored by the FDA and the National Institute of Health, and it showed that people had less symptoms at night than they did before surgery, like halos and glare, and overall less symptoms of dryness in their eyes and just comfort with their eyes. So we've come a long ways.
I think your point was very well taken in that a lot of people fear glare after LASIK surgery because they've heard that people in the past have had glare. Well, the treatments have changed and the ablation zones have gotten bigger, and according to the Prowell study, which is a very objective study, we now know that patients actually have less glare following LASIK surgery than they did before.
Right, and that's an FDA study looking at the outcomes of LASIK that was just recently released.
I tell my patients during surgery that you can't mess it up. We have such good technology that they should be very comfortable having it done.
What about dry eyes? You know, the public hears a lot about dry eyes and LASIK.
We're much better at diagnosing who is likely to develop dry eyes, and so what we do is we do several tests to find out if they do have dry eyes, and if they do, we treat it until they no longer have dry eyes, and then we can proceed with confidence that they're not going to have those symptoms. And so that is very important.
And that again is a shift from where we were 10 years ago, where anyone who walked in and said, I have dry eyes, we pretty much said, you're not a good LASIK candidate.
That's a good point. There's still a lot of people walking around right now that think that they're not candidates for LASIK because they've been told that they have dry eyes and therefore they cannot do the surgery. I know that you've had LASIK surgery and you had a dry eye issue prior to that.
Right, my dry eye issue was cured because a lot of our patients, as we all know, who come in for LASIK are wearing contact lenses, right. And it's really the contact lenses that are the problem.
Some people talk about, I'm not stable for surgery, or my LASIK wore off.
Right, pupil size.
Pupil size.
Treatment of astigmatism.
Yeah, so we treat huge amounts of astigmatism very predictably, just like we treat nearsightedness with confidence that they're going to have excellent vision. As far as farsightedness, again, the new lasers give us incredible outcomes. What about people that tell you I'm not stable? What do you tell them?
I tell them I'll be the judge of that. It happens all the time that patients come in and they say that their prescription is not stable. Well, if they're older than the age of 18 or 19 years old, their refraction is stable.
95% of patients are stable by the age of 18. And the nice thing is we can do an enhancement. So if there is change many years down the line, it's easy to do enhancements and bring them back to where they want. But most patients want to just wake up and function without dependence on corrective lenses. So even if there is a little bit of correction left, people have that freedom so they can throw the crutches of glasses and contact lenses.
So if we smashed all the myths, I think so, huh?
I believe so. I believe we've covered it.
You know, in the last 10 years, technology has taken LASIK to a procedure that's very predictable and very safe. And I think you can see that from our panel of experts here.